When we talk about candidiasis, we often think of vaginal candidiasis, but Candida is found on the skin, in the oral cavity, in the genitourinary system, in the gastrointestinal tract, and in all our mucous membranes alongside a complex microbiota. Candida is a dysmorphic unicellular fungus. What does this mean? It means that it can be found in our body in two forms: as a yeast that lives in symbiosis with the host, that is, with us, or as a filamentous fungus, which is when it behaves as a pathogenic parasite. Its virulence arises from changes in the microbial ecosystem. This usually begins in the digestive tract. We call this intestinal dysbiosis. Intestinal dysbiosis has various symptoms that can be digestive, such as bloating, poor digestion, alterations in intestinal transit, and gas, as well as extradigestive symptoms of various kinds. For example, the fungus Candida acts on estrogenic and hormonal receptors in general, preventing hormones from performing their function. Candidiasis is often associated with premenstrual syndrome or even likely linked to infertility. In many patients who visit the clinic for chronic diseases, when we study their flora, we see that there is significant intestinal dysbiosis. Overgrowth of Candida, for example, produces an increase in histamine, which is associated with dermatological diseases, is even linked to migraine, and is also associated with many allergies. When someone is going to lose weight, if we study their flora and see that there is an overgrowth of Candida, we need to know that it will be much more difficult for them to lose weight. One of the things we need to do initially is to treat the intestinal flora, improve its permeability, enhance the digestive tract, and this will make the loss much more effective. The treatment for candidiasis must, of course, include a personalized dietary plan along with a series of other therapeutic tools. The treatment will not only be a diet alone is simply not effective, nor will a treatment without proper nutrition be effective. In dietary treatment, it is important to restrict fast sugars and refined flours as much as possible. Why? Because the fungus Candida primarily feeds on sugars. However, there are many very restrictive diets regarding sugars, but over the years we have been able to verify that certain sugars, such as those found in fruit, are important if consumed in moderation. Why? Because completely removing fruit often leads to an alteration of intestinal transit that is counterproductive. The treatment of candidiasis has three main phases. In the first phase, detoxification and treatment of intestinal permeability are carried out. The next phase will be elimination, and the final phase will be intestinal repopulation, where probiotics are administered, but probiotics should always be given at the end of the treatment. In this treatment, in addition to the diet, we will use tools such as orthomolecular supplements and others like ozone therapy, which are very useful. As we are seeing, the treatment of candidiasis is complex and should be approached in a holistic manner because we are not dealing with a local problem, but rather one that tends to affect the body systemically.